So program is called Impella Heart Program, and we have a fantastic team. Cardiologist myself, K.P. Suresh Kumar sir is the head of the department, Dr. Manoj, Dr. Sundar, and now Dr. Shaktivel. And we have visiting cardiologists as well as a big cardiothoracic as well as heart transplant team. Dr. Kumud Dittal is a very well-known, renowned cardiothoracic surgeon, heart transplant surgeon. He did the first heart transplant after circulatory death donation, DCD donation in the world. So he's joined with us for the heart transplant program. So we also welcome him, and we have a fantastic critical care support team, perfusion. So that's why it is possible to do this kind of program in Chennai. Otherwise, it will be impossible to do unless you have a coherent and coordinated team. It will be impossible to do such a program. So cardiomyopathy, obviously, Dr. Suresh Kumar sir already mentioned what is cardiogenic shock. The shock அப்படினாக்க அந்த ஆடியோ வந்து இது பண்ணுவானா இதை பாருங்க. ஷாக்ன்றது ஹார்ட் பம்பிங் வந்து இருக்காது. ஹார்ட் பம்பிங் குறையறதுக்கு காரணம் ஒன்று மசில் அஃபெக்ட் ஆகணும், ஹார்ட்டோட மசில். இப்போ கோவிட் வந்தது இல்லையா, கோவிட் வந்த சமயத்தில் கோவிட் டைரக்டாக ஹார்ட் மசில் அஃபெக்ட் பண்ணும், அது மயோகார்டைட்டிஸ்ன்னு சொல்றது. ரெண்டாவது வந்து ஹார்ட்டோட பிளட் சப்ளை கட் ஆகணும், ஹார்ட் அட்டாக். ஸோ இஃப் த ஹார்ட்ஸ் பிளட் சப்ளை இஸ் கட் ஆஃப், இட்ஸ் ஹார்ட் அட்டாக். And if the heart muscle is affected, it is myocarditis and cardiomyopathy. So on the slide la kaamichirukka madri, so any one of those can cause cardiogenic shock. Left side heart attack varalam, right side heart attack varalam, and the pulmonary embolism, cardiac tamponade na heart sutti neer irukkiradhu, endocarditis, or after heart attack and the fast heart rate. Idu ellathillume patient will have cardiogenic shock, cardiac arrest oda varuvanga. But main thing, the first two, heart attack illa myocarditis, adanaala varumbodhu we have to give rest to the heart. Current treatment ipo enna pannum appadinaka vanda odane we will give lot of medicines to increase the heart rate and increase the blood pressure. அது பண்றதால actually we are doing harm to the heart. It is almost like ஒரு ரொம்ப tired horse நீங்க இன்னும் வந்து தட்டி ஓட வைக்கிற மாதிரி. So you are just beating a tired horse to run. So that is what we are doing so far. அது பண்றதால the heart becomes worse and worse and worse. Within 24-48 hours the heart will deteriorate and patient will die. So இதை prevent பண்றதுக்கு தான் further treatment Impella மாதிரி. I will show you in the further slides. So this is what happens. Cardiogenic shock oda ஒரு patient hospital வந்தாங்கன்னா 50% of them will die. ரெண்டு பேர் வந்தா ஒருத்தவங்க கண்டிப்பா இறந்துருவாங்க. Another 10% will die within 60 days. So that keeps on going. So the survival rate without a proper treatment is literally less than 5%. இதுதான் நான் சொன்ன மருந்து. We will give drugs to increase the heart rate, blood pressure. ஒன்று கொடுக்கும்போது you will have a slow sort of mortality 3%, but 3 drugs கொடுக்கும்போது 80% of them will die in hospital, and this is what will happen. 80% of the time will die without any mechanical circulatory support. இப்போதைக்கு நம்ம பண்ணக்கூடிய சப்போர்ட்னு பார்த்தா balloon pump actually patient coming in cardiogenic shock as such it doesn't do much. ECMO வந்துட்டு we all know about ECMO. COVID சமயம் அதுக்கு முன்னாடி வந்து ECMO னா என்னன்னு தெரியும், but ECMO is a very very complicated thing. And if anything, ECMO adds more work to the heart. We are putting back the blood, so it comes back. ECMO adds more work. So the only thing that will give rest to the heart, at the same time give enough supply to the brain, kidneys, other places is Impella. So this is the left side pump. You can see that it's a small pump or motor. It's Impella. It will suck the blood and put it in the aorta. Basically, that is what the heart does. The left ventricle main pumping chamber pumps the blood to the rest of the body. Same function will be done by this pump. It takes the blood and puts here. அப்படி பண்ணும்போது it gives rest to the heart. At the same time it maintains the perfusion to the brain and other places. Same support can be given to the right side. Pulmonary embolism னு சொன்னேன் இல்லையா, அது மாதிரி இருந்தா you can put the right side support. இதுவும் இப்போ it's available. So by doing that, we can improve the prognosis from less than 5%. For 75% survival, they have shown in US, the current cardiac shock registry, they are able to get 75% survival in cardiogenic shock patients. So same animation of what the Impella does. Kaal valiya or chinna tube valiya, we will put it through a small femoral access. We will put this pump over the wire. We will place it in the left ventricle. This is the main pumping chamber. அது பிளேஸ் பண்ணதுக்கு அப்புறம் the motor will start spinning, the blood will be sucked from the left ventricle and put it in the aorta. Basically, that is the function of the left ventricle. By doing that, you are giving enough oxygenated blood to the brain and kidneys and other organs. Adhe samayatila you are giving rest to the heart, and coronary perfusion also maintained. So you are giving rest to the heart to recover. Without that, the heart will deteriorate further and patient will die. So two places you can use it. You can use it in two places. One on the cardiogenic shock I showed. If you intervene here, you can get back the heart and recover the heart muscle. Same time, some of the patients and the heart blood vessels, some of the patients will not be able to have surgery. And the patients stent pandradhu romba high risk. Appadi pannakulla indha maadhiri pump support koduthu panna the prognosis is better. So both idu. So one for protected PCI and one for cardiogenic shock. So now they have proven that 20 years and the survival benefit with the Impella pump they are able to show in US that 75% survival is achievable. I think Dr. Sanjog will mention that later on in his talk as well. You will see that. So this is our own case. COVID samayatila we had the first case in Asia Pacific. It's not in India, it's not in Asia. The whole of Asia Pacific, this is the first case of acute COVID myocarditis treated by Impella and the heart recovered. It's an 18-year-old boy, sudden collapse at home. Fortunately, family members knew how to do CPR. I keep on telling the press and everybody should learn a bystander CPR. You just go to YouTube and put a CPR, 2 minutes chest compression. Chest compression 2 minutes help. If you do that and bring that patient, the chance of survival is more than 30%. We can revive the patient. Without that, just if you bring him, we will lose him. So chest only compression for 2 minutes. So the patient he was almost dead. 18-year-old, multiple shocks, and he was seen in another hospital, transferred here, COVID positive. In the numbers line, it is not acceptable for survival. But when he was supported with the multiple drugs, but within 4 hours, we could do the Impella. Heart team discussion panittu. That was the echo, severe LV, less than 15%. So ECMO we did Impella, and Impella ported right side support we were thinking about ECMO later on. So if you look at the fluoroscopy, that is the Impella pump. This is a catheter that is left to monitor the patient's cardiac output, saturation, continuous monitor. That's very important. So this is the pump. Immediately after 2 hours, the heart started showing good recovery. All the numbers started coming down. This is at 1 day, completely X-ray full clear and the pulmonary edema full clear 24 hours heart recovered. 3rd day, 4th day. Heart function 50%, less than 15%. The heart improved to 50% on 4th day. 4th day, Impella touch. He had a complete heart recovery. Without Impella, he would have died. So, what is the purpose of this program? Obviously, Impella what is the purpose of this program? To get that Impella controller and the pump, you need to contact the company. That is the current state in India. Company will bring it from Delhi or Hyderabad. It will take a good 24 hours for them to bring it. But if you delay it for that 24 hours, if you don't do it within that 4 hours window, if you are able to do it within 2 hours window, you reduce the mortality to less than 34%. You can save at least 66 patients. But if you delay it by more than 4 hours, you will lose 74% mortality. So the earlier is better. Hypercritical situation, that's not possible. That is why Kaveri Hospital management has helped big time, so that we could get that Impella controller on our own. And the program is all our staff. At the moment, company they will monitor it. But we are going to train our own staff. That is going to be the level 1 unit. Our own cath lab staff, our own perfusion staff, our own surgeons, cardiologists. So we will be doing it. We will be monitoring it. Cost will be less for the patient. At the same time, it will be done within the time needed. And the 4 hours it will be done. So most of the patients will recover. So that is the main thing about this heart recovery program. And that's going to be the team. Thank you.